Welcome to the deep dive. Today we're really getting into dermatomyositis. It's this inheritable inflammatory thing in dogs.
Right. Affects the skin, muscles, blood vessels.
Yeah, and you, our listener, shared some pretty detailed medical info. Our mission really is to pull out the key stuff for you.
Make it understandable, right?
Yeah,
Without drowning in jargon.
exactly. We want you to get what it is, who gets it, what it looks like, and, how it's managed.
Okay, let's unpack it.
So it's inherited inflammation. Skin, muscle, blood vessels. A tough combo.
It really is. Primarily in young dogs of certain breeds, they sort of inherit this predisposition.
Inherit, so it's genetic. But what actually sets it off, the sources say the exact cause is, well, unknown, idiopathic.
That's the tricky part. We don't know the precise trigger.
Well,
But there's a really strong family link,
yeah.
especially in collies and Shetland sheepdogs.
Okay.
The info points to autosomal dominant inheritance. But it's got variable expression, meaning even if they inherit the gene, it might not show up, or it might show up really differently in terms of severity, like a switch that flips differently for each dog.
Got it. So they have the potential, but something needs to flick that switch. The sources mention some suspects being looked at.
Yeah, researchers are investigating a few things. Infectious agents, maybe viruses especially. Also looking at vaccines, some drugs, maybe even underlying cancers, toxins, or other infections. Kind of like what they see in ischemic dermatopathy sometimes.
Ischemic dermatopathy. Okay, that sounds related but different. We should maybe clarify that later.
Good point.
But first, the text suggests it's likely an immune issue, like autoimmune or immune-mediated.
Yeah, based on what vets see clinically and under the microscope, the histopathology, it really points towards the dog's own immune system kind of messing up.
Oh, so?
It seems to mistakenly identify its own skin and muscle cells as foreign invaders and attacks them. Friendly fire, basically.
Okay, friendly fire from the immune system. And the main battlegrounds are the skin and muscles. Source mentioned skinexocrine and musculoskeletal systems.
That's right. Those are the systems that bear the brunt of this inflammatory response.
Okay. So which dog breeds are most likely to be in the line of fire here? Collies and Shelties, we mentioned them.
Definitely top of the list for this specific inherited form. But the info also flags Busseron Shepherds, Belgian Tervurennes, and Portuguese water dogs as being predisposed too.
So if you have a puppy from one of those breeds showing odd signs, this should be on the radar.
Absolutely. It becomes a key differential diagnosis.
And then there was that note about other broods having similar signs. That's where this ischemic dermatopathy comes back in, right?
Exactly. This is pretty important. You might see symptoms that look like dermatomyositis in, say, mongrels, corgis, terriers, chow chows, German shepherds.
Quite a few.
Yeah, but some of those cases are now thought to be this other thing, ischemic dermatopathy. It looks similar, but the underlying cause might be different, not necessarily this specific inherited pathway we're focused on.
Ah, okay. That distinction is really useful. So focusing back on the main condition, when do symptoms typically show up? Is it an old dog disease?
No, usually the opposite. Skin problems tend to start in young dogs, often before 6 months old.
Ah, young.
Yeah, sometimes as early as 7 weeks. The whole picture usually emerges by the time they're a year old.
Okay.
And interestingly, sometimes the signs can lessen a bit as they get older. There is an adult onset form, but it's rarer and usually milder.
And any difference between males and females?
Nope. The source says no reported sex predilection. Seems to affect both equally.
All right, so we're picturing a young dog, probably one of these predisposed breeds. What's the first thing an owner might notice? The text said it varies a lot.
It really does. It can be super subtle, maybe just a few small skin spots, or even muscle inflammation that you don't really see subclinical myositis. But on the other end of the scale, you can have really severe skin issues, plus noticeable muscle wasting, a weird walk, even trouble swallowing because of megaesophagus. It's a huge range.
And it's wild that puppies in the same litter can be so different.
Right. The source really emphasizes that. Littermates can have it, but one might be mild and another severely affected. That variable expression we talked about.
So let's get specific. What might an owner actually see? The text mentions waxing and waning lesions. What does that look like day to day?
Think of skin problems that flare up, then maybe get a bit better, then flare up again. Not just a steady decline.
Okay.
You often see these around the eyes, the lips, on the face, inside the ear, flaps the pinnae, the tip of the tail, and over bony spots like elbows or ankles, especially in those young dogs under 6 months.
And when those spots heal up, do they leave a mark?
Often, yeah. Scarring is pretty common. You might see patches where the hair doesn't grow back right or the skin just looks or feels different.
The text also mentioned muscle atrophy, the masseter, and temporal muscles. Those are head muscles, right, for chewing.
Exactly. So you might literally see the muscles on the top and sides of their head looking thinner, wasted away.
That sounds concerning.
It can be. In bad cases, that weakness makes it hard for them to eat, drink, or swallow properly.
And the gait. Stiff or high stepping, what's causing that?
That's usually down to the muscle inflammation, the myositis in their legs.
Yeah.
It makes movement uncomfortable or weak. So they might lift their feet higher than normal, kind of like they're marching or stepping over invisible obstacles.
Okay, let's dig into the skin lesions more. The description sounded pretty varied. Crusted erosions, ulcers.
Yeah, you can see a mix.
Yeah.
Crusted spots, little open sores or ulcers, hair loss, alopecia redness, scaling, and like we said, scarring.
Where exactly?
Mostly face, around the mouth and eyes, inside the ears, tip of the tail. Sometimes the whole face can be involved.
And not just the face and tail, pressure points too?
Correct. Places that get pressure when they lie down, like over the wrists, carpals, and ankles.
Any other spots? Maybe less obvious ones?
Uh-huh. The source mentions foot pads can get ulcers, sometimes even inside the mouth. And you might see weird-looking nails. Or they might even lose nails.
Wow, okay. So it really can show up in a lot of ways. We've covered skin. Back to the muscles, the myositis. That sounds like it has a range, too.
It does. Could be really subtle, maybe just a slight shrinking of those temporal muscles on the head that you might not even notice at first.
Or
Or it can be much more dramatic, like generalized muscle wasting all over the body, symmetrical, leading to that stiff gait we talked about.
and we definitely need to mention megaesophagus again. That's a big deal, isn't it?
Huge deal. Very serious complication. The esophagus gets enlarged and floppy, loses its tone.
So food doesn't move down properly.
Right. It just sits there or gets regurgitated easily. And the big risk is aspiration pneumonia food or liquid getting into the lungs. That can be life-threatening.
Man, this sounds like a really tough condition. So how do vets actually figure out if it is dermatomyositis? Sounds complex.
It definitely can be. There's no single aha test. It's more about putting puzzle pieces together.
Like what pieces?
The dog's breed, their age, the clinical signs you're seeing, and then diagnostic tests. Skin and muscle biopsies are really key.
But even those aren't straightforward.
Not always. For skin biopsies, you need to sample the right spot, avoid areas that are secondarily infected or are already badly scarred, because that obscures the primary changes.
Okay.
And for muscle biopsies, the inflammation can be patchy, so you need to try and biopsy a muscle that's actually affected. Hitting a normal spot doesn't help much.
Right. How do they find an affected spot? The text mentioned EMG.
Yeah, electromyography. It measures electrical activity in muscles. Abnormal patterns can point towards affected muscles, guiding the biopsy.
And if EMG isn't available,
Then usually you'd biopsy a muscle that looks or feels wasted, or maybe one that seems tender.
and making it even trickier, other things can look like this. Yeah. The source listed a whole bunch of differential diagnoses.
Exactly. This is why vets have to be detectives sometimes. You've got to rule out things like Demodex mites.
Mean.
Right, ringworm, that's dermatophytosis. Bacterial skin infections, something called juvenile cellulitis. Even other autoimmune diseases like lupus, both the skin form, discoid, and the systemic kind.
Wow.
Plus other muscle diseases like polymyositis, that ischemic dermatopathy we mentioned, and even a rare blistering condition called epidermolysis bullosa simplex.
That's quite the list. It really highlights why just looking isn't enough.
Definitely need that thorough workup.
So besides biopsies and maybe EMG, any blood tests that help?
Yeah, blood work can add pieces to the puzzle. Creatine kinase, or CK, it's a muscle enzyme, might be elevated if there's muscle damage.
Okay.
Testing for anti-nuclear antibodies, ANA, helps rule out systemic lupus. And interestingly, some studies found higher levels of certain antibodies like IgG and circulating immune complexes seem to correlate with how severe the dermatomyositis is.
So lots of detective work. Observation, breed, tests, putting it all together. Once you do get a diagnosis, what's the plan? How is it managed? Is there a cure?
Yeah, the tough news first.
Yeah.
The source is clear there's no cure.
Right.
Management is really about supportive care and trying to dampen down that faulty immune response, control the inflammation.
Is it always hospital-level care?
Usually not. Most dogs are managed as outpatients. But if they have severe muscle issues or that dangerous megaesophagus, then yeah, they might need hospitalization for intensive support like feeding tubes.
And in really bad cases.
Sadly, in very severe progressive cases where the quality of life is poor and declining, euthanasia is sometimes the kindest option to discuss. It's a hard conversation.
Understandable. What about the day-to-day supportive stuff for dogs managed at home?
Practical things like gentle bathing to remove crusts, which can make them more comfortable and help prevent secondary infections.
And treating those infections if they pop up.
Absolutely. Antibiotics if needed. Also, modifying activity, avoiding rough play or things that could injure the skin, and limiting sun exposure is important too.
Why the sun?
UV light seems to make the skin lesions worse in some dogs.
Okay. And medications. The list was pretty long in the source.
Yeah, several options are often tried. Things like vitamin E and essential fatty acids like fish oil are often recommended just for general skin support.
Makes sense. What about stronger stuff?
Prednisone is a common one. It's a steroid, a potent anti-inflammatory. Usually start with a higher dose to get control, then try to taper it down slowly to the lowest dose that still works.
To minimize side effects, right?
Exactly. Sometimes non-steroidal anti-inflammatories, NSAIDs, might be used too. Then there's pentoxifylline.
What does that do?
It's thought to help improve blood flow to the skin and might have some immune modulating effects. But the source mentions some cautions. Dogs sensitive to related drugs shouldn't get it. And it can affect clotting, so monitoring is key.
Good to know. What else was on the list? Tetracycline antibiotics?
Right, tetracycline, doxycycline, or minocycline, often combined with niacinamide, which is a form of vitamin B3. That combination seems to have some anti-inflammatory and immune effects, particularly on skin.
Interesting combo.
And topical tacrolimus ointment can be used directly on skin lesions sometimes.
So quite a few tools in the toolbox, but it sounds like finding the right mix can be trial and error.
It can be.
Hmm.
And because the disease naturally waxes and wanes, it can be hard to tell sometimes if treatment is truly working or if the dog is just in a better phase of the cycle.
That must be frustrating for owners.
Definitely, which is why client education is so important.
What are the absolute must-knows for an owner?
Number one, it's hereditary. Affected dogs absolutely should not be bred, period.
Crucial point.
Number two, it's not curable. Even if symptoms improve or disappear for a while, the underlying tendency is still there. Manage expectations.
Okay.
And number three, have ongoing, honest talks with your vet about the prognosis, potential complications, and quality of life to make the best care decisions along the way.
What about prevention, aside from breeding? Anything else?
The source mentions considering neutering, maybe to remove hormonal influences, though the evidence for that isn't super strong. And generally, minimizing skin trauma and sun exposure are good supportive measures.
We touched on complications like megaesophagus and pneumonia. Any others to watch for?
Secondary bacterial skin infections are really common. Need to stay on top of those.
Okay.
Scarring is another big one. Mild cases might have minimal scarring, but moderate to severe cases often have permanent changes to the skin and hair coat.
And functionally?
If the chewing muscles or esophagus are badly scarred, that can cause lifelong problems with eating and swallowing. And damage to limb muscles can mean persistent lameness or stiffness.
So bringing it all together, what's the long-term outlook?
It really depends on the severity.
How so?
For dogs with very mild disease, the prognosis is pretty good. It might even resolve on its own without much long-term impact.
That's hopeful.
For mild to moderate cases, it often tends to burn out eventually, but usually leaves some residual scarring. The dog might look a bit different, but can have a good quality of life.
And the severe end.
Unfortunately, for dogs with severe progressive disease, especially those with significant muscle damage or megaesophagus early on, the long-term prognosis is generally poor. The damage can be just too extensive and debilitating.
Okay, so summing up, dermatomyositis. It's this complex, inherited inflammatory disease. Hits certain breeds hardest.
Right. Collies, Shelties, some others.
The signs vary hugely. Making diagnosis a real process needs careful examination, ruling things out, specific tests like biopsies.
Yep. Piecing it all together.
And management isn't about a cure, but controlling inflammation, supporting the dog, dealing with secondary problems.
Focusing on quality of life.
So hopefully, you listening now have a much better handle on dermatomyositis beyond just the name, really understanding what it involves, how it looks, how it's tackled. Hopefully this deep dive cleared things up.
Yeah, it gave you some solid insights.
Definitely. Now, here's something to chew on. Given that it seems to be this mix of genetics and maybe environmental triggers, what kind of research do you think could really crack this thing open? You know, find ways to maybe prevent it or treat it more effectively down the line?
That's the big question, isn't it? Lots to still figure out.
Absolutely. Something to think about. Thanks for diving in depth with us today.